Alright, so go ahead. Here, Natalie. So this one, we're going to do this one on this side. So this one's real movie. This one's kind of moves around. So that's why these sometimes can be tricky. Even though it's sticking out really easy and looks like a good one, it's moving around. It's tricky. This one's a little bit more stable. So we'll start with this one. If not, we'll jump over to here. Okay. Yeah. Since you ride your bike all the time, you've got some good. So I'm going to go ahead and hold this. There we go. That's it. That's the ticket. All right. So once you got it in, you're good. So that was kind of the tricky one in yours, is it because when they roll, those are the ones that make it kind of, see, as soon as you push it, see how far out it goes? Mm-hmm. Whereas this one's a little bit more stable, this antecubital vein. So I went with that one to get a little bit better.
Yeah, that one there is out of course then.
Yeah, it's just, it's just the way your anatomy, the way your vasculature is, so. But yeah, you're doing really good. So we use these vials, so it's a vacuum container there so that you can see. You're holding that up a little bit so you can see it filling up. Why don't you come over here now?
I can see it really well right here.
Okay.
Yeah.
So you can see when you plug it in there, it's a vacuum and it's filling up, and you've got a real good vein. It's filling. So that's a good normal flow rate. If it's going slow or it's not in the vein real good, it'll take longer. And so it's nice. You want to make sure you're in the vein really well to get it to flow right.
Well, I don't smoke or drink, so.
Well, that's what's helping this. I mean, yeah. No, you've got some good stuff. That's why you're going to heal really well. You probably have, you're going to do really good because this is going to help with the healing. And because you're healthy, we're using all your stuff for you. Okay, we're going to take this out. So we've got 40. There you go. Put a little pressure on that for me. So now we're putting it into our intraspin centrifuge. We got 4 vials, so they want to balance it. So you want to have 2 on either side. You've got, these are going to balance that, so you want them even, so when it spins, it's nice and stable. And then we got the RPMs at 2,700 and time at 12 minutes. And hit start. That's it. Okay, so we're using the laser. You got the soft tissue setting at 2. I usually like to do 50, and then I'll usually go up to like 2.5 or 2.25, 2.50 for soft tissue. All right, so no scalpels. We're just going to use a laser to get this all opened up. So we're taking out 14. Got an infection, so I'm just using the laser right around the tissue. Are you able to see kind of the tip of that a little bit? Good. So I'm just using the laser, and that you can kind of see. I don't know if you can see this, but I'm pulling the tissue out, so you can see how the tissue's coming away from the bone, and I'm pushing down on it. So I'm already moving the gum away, and that's going to help with our barrier. The platelet-rich fibrin barriers will be perfect for this site. Sometimes I'll use a PTFE if you need it. So I'm pushing down on there, so you can kind of see how that tissue is getting reflected. Are you able to see okay in there? So even though I haven't used any scalpels or anything like that, I'm just basically pushing, getting the tissue all ready for the next. And you see there's very little blood. That whole area, after doing, pretty much I've got the tissue reflected, and now with no blood, which is kind of nice. Okay, so go ahead and pause that.
Okay, so now the PRF is done. I'm going to take each vial that we spun down out, what they look like now. Going to open up the vial and take out the membrane. Now we're going to scrape off the red part. And place it in the container over here. And I'm going to put this lid on top and it's going to flatten it for us.
Which is the thick barrier.
Thick barrier. The next one.
I found using that other dish it was easier to scrape because it's a longer wall.
Forgot.
I think that's what you showed me.
I did. I just realized that right now. This one is going to be
You doing okay, Donald?
placed
Down that a little bit?
in this small
You
container.
And do you put the red end down?
Yes.
I'm all right now. Okay. Good. Things going good. You're doing really good.
Kind of gently.
Is that bothering
Massage
you?
it
Are you
into the
feeling
hole.
it at all?
I have found centrifugal, or the gravity pulls it by the time you get
Sometimes
the
when
other
there's
two
an
out.
infection, it can be a little
And then
sensitive.
place this plug
You're doing really good though.
on top.
This tooth is really brittle. I think it's probably good taking this out. Trying to save that if you're probably not been.
I usually put in after I get the other barriers done because it's gone down inside there far enough. That's why we're about to dropping those things and then not having them.
Number 3. This one I'm going to place on the very top of this container, red side up. And the last and fourth one. I'm going to place inside this dish. And this one we're going to use to chop up and mix in with the bone.
So you don't flatten it out in the membrane first.
Now what I do, I just let it sit and I, Okay, you can stop it. Okay, now so we have the last barrier in this dish and I'm going to chop it up to mix with the bone. Try to get it as small pieces as I can. And suction out any extra liquid. And this we're going to use to place in the extraction site. And we're going to pour the chops inside.
This might be a little tender here. This is where you have that infection, so hang in there. You okay? Okay. I'm going to use a laser to kind of disinfect that bottom of the socket because it's well, the granulation tissue. And then you lost the bone. You've lost a lot of bone on that outside. That's where we use the graft when we put that bone in there to put that bone back for you. I couldn't see that on the x-ray, but now when I'm in there, it's quite a bit of bone
Okay,
loss.
you stop it. So this is the membranes that we flattened from this tray over here. So I placed them on the glass slab. We have two membranes, a thick one and a thin one. And then this is a plug. And then we have the bone with one of the barriers chopped up mixed inside this, ready for grafting. And then we also have the syringe with an extra put inside the socket site.